I remember getting the text message that it was stage 4 and it had spread to the bone.
Me and my wife wouldn't have, it would take us 10 times as long, if not longer, to try to find somebody that could do whatever we needed done. And to be honest, even if we found a person, we don't even know if that person is qualified. They may say they're qualified, but they may not be one of the top people in the industry.
When an employee's family has a really tough diagnosis, that's what occupies your mind. You can't focus on work. It's hard to focus on anything.
Searching for healthcare information on the internet is very dangerous because it's suspicious as who put the information there and how valid is the information that's there.
There's no real one place to find resources, and there's no one expert to rely on for information. And so what we do in the services that we provide is we actually take the onus off of the shoulders of the people that we serve.
We take care of a lot of complex cases like joint replacement, heart valve surgery, cancer, pediatric dilemmas.
You get unlimited access to our service team, and that includes what we call physician referral reports, which provides referrals to top physicians. That's 13 years of us forging relationships with physicians.
He's a great doctor, great oncologist, but he hadn't seen her case before. So he suggested that she seek other more experienced opinions from other experts in breast cancer oncology to see what they had to say about treatment and what they would recommend. He wasn't able to schedule that appointment and get the records to where they needed to go. Because I have access to PinnacleCare through my employer, I was able to quickly alert them of the situation. The team dove in right away.
We'll jump the hurdles for the patient, or for the member rather. So if it's a doctor that's really hard to get into, then we talk to the office.
It's incredible how they were able to basically negotiate slides from one hospital to another and work out the kinks.
In a complex problem, the first thing you have to do is ensure that the diagnosis is correct. Somewhere between 20 and 30% patients are misdiagnosed.
We've had quite a few cases where we have had someone with a breast cancer diagnosis where they were diagnosed with the wrong kind of breast cancer that might have made a difference between whether or not they needed a mastectomy or not.
This is analogous to the other types of insurances that you might have, from life insurance to disability insurance to even auto insurance, where you hope to God you don't need it. But the peace of mind of knowing that you have it when you do need it is well worth it.
When you or someone in your family is facing such a terrible diagnosis, you feel paralyzed and frozen. You know you need to do something, but you don't know what to do and you don't know how to do it. And having PinnacleCare take that burden off your shoulders and just do something that they know how to do day in and day out, which seems like an insurmountable mountain to you, is such a relief.